Olympia Weiss is only 8 years old.
Look at this. Oh, you can make a wish.
But she already knows a lot about suffering.
When Olympia does complain of her legs hurting, it's usually her knees, her thighs, and her shins.
They felt like they were broken, like it had broken my knee. And it really, really hurt.
Nice big breath.
In school, I couldn't really think straight because my head would always hurt. It would just feel like something was just like pressing on them, or someone had put a needle right through my head.
Does that hurt at all?
Olympia has Lyme disease, one of the nation's fastest growing infectious diseases.
The incidence of Lyme disease is greater than the HIV cases, West Nile virus, swine flu combined.
We estimate that several 100,000 people a year get a new case of Lyme disease.
Does that feel okay?
It's not in the news much. It's this kind of insidious, hidden epidemic.
Lyme disease gets its name from the place where it was first noticed in the United States in the late 1970s, among the children of Lyme, Connecticut.
The peak of Lyme disease is in young children because when you think about it, who's out crawling around in the grass and playing in the woods?
But Lyme disease is no longer just an East Coast problem. The ticks that transmit Lyme disease have been found in all but 2 of California's 58 counties.
Okay, let's see what we have here. Ticks are infected with the bacteria that causes Lyme disease. And that bacteria is found in western black-legged ticks. And those ticks live in the woods, they live in the grasses, they live all around here in California.
To combat Lyme disease, 6 friends who know its devastating effects firsthand started the Bay Area Lyme Foundation. Some suffer from it. All have friends and family struggling with its long-term effects, because Lyme disease is often misdiagnosed.
When we want to catch the disease early in the first few weeks, when it's easiest to treat, that's when the blood tests are really less than 50% accurate. In fact, you're better off flipping a coin. With a coin flip, at least you'd get 50%.
And a wrong diagnosis can mean a lifetime of chronic pain and debilitating illness.
The bacteria has figured out how to evade the immune system, and so without treatment in that early stage, we know that more than half of the people, the bacteria will find a place to hide, and the immune system won't be able to get rid of it.
There was jaw pain, almost like lockjaw, and your teeth hurt. There's a throbbing pain. There's eye pain. There's a shingles type pain where it feels like something's crawling underneath your skin. But people don't get it. The medical community doesn't get it. Your friends don't get it. Your family doesn't get it. To them, you look normal, or you're having a good day, or you're slowly getting better. And every single day, all day long, it's a battle.
The Bay Area Lyme Foundation is fighting that battle on 2 critical fronts.
One is to find a better diagnostic for Lyme disease. And then second is to find a therapy for people that have had Lyme disease for a very long time.
But to do that, researchers need blood samples that are hard to get.
Maybe 1 in 5 researchers out there can get blood samples that they need desperately for their research.
So the Bay Area Lyme Foundation will be funding initiatives to increase the supply of blood samples for scientists working to develop a reliable diagnostic tool.
I'm sure that once we unlock this bottleneck of researchers, we're going to be making discoveries right and left. It's just waiting to happen.
The foundation is also supporting researchers at Stanford University who are studying how to starve the Lyme disease bacteria to prevent its growth. Innovative approaches like this, marshaling the resources, talent, and ingenuity of Silicon Valley, could lead to the kind of breakthroughs that have already happened with HIV/AIDS.
Over the last 20 years, we have new therapies, we have better treatments, our HIV/AIDS patients live healthy, productive lives. The opposite's true for our chronically ill Lyme patients. They have no options, they have no therapies, and their quality of life is terrible.
I don't think it's going to take the 20 or 30 years that AIDS took. I think in 5 to 10 years, we should have a solution to this problem.
We will find a cure. This is a fight we can win.
Lyme disease is terrible. Won't you please help us fight it?